We are on to Hello Mumbai, listening to All India Radio's FM Rainbow channel on 107.1. And like I mentioned earlier, we're going to be in conversation with three different doctors. The first one is Dr. Ram Tainwala, who's an MBBS MD dermatologist and practicing at Malad since the past 10 years. And we're going to be talking about the side effects of frequent hand wash. Hello, doctor.
Yeah, hi, good morning, boss.
Yes, doctor. Like I mentioned, we're going to talk about the side effects of frequent hand wash.
Yes, so firstly, let us not get away from the fact that hand washing is very essential and it is a mandatory thing to do in this scenario of this highly infective epidemic going on.
Right.
But we need to understand that if anything is done wrongly, it can definitely have detrimental effects.
Mm-hmm.
So people should understand that wearing gloves and masks are much more beneficial so that they do not come in direct skin contact of the virus. So we are preventing half the problems at the root level. So that would be beneficial for people who are going out on a regular basis to bring their groceries, or people who are handling other stuff and etc. Also, some things which we can follow to prevent this side effects of excessive hand wash is we all are told to follow this 20-second rule of washing our hands with soap for the 20 seconds. But what kind of soap you use for washing our hands is very important. So we strongly recommend not using harsh soap like those so-called antibacterial hand washes and those fragrant-based hand washes. We can rather switch to milder soap, even a baby soap or even a Syndet bar, which is available in the chemist, is a more pH balanced and milder version, which can help you in preventing the dryness to the skin and removing the natural lipid layers of the skin.
You're not recommending a medicated soap?
No. The medicated soap, there's something called as Syndet bars, which are available in the chemist, which are called synthetic detergents. So that is what is recommended. But however, the so-called claims of antibacterial hand washes and strong fragrant hand washes are more harsher to the skin.
Mm-hmm. And what about the use of sanitizers?
See, sanitizers are good for people who are on the go, who do not have one opportunity to wash their hands frequently. Mm-hmm. So if I'm a healthcare worker, or if I'm a bus conductor, or if I'm a vegetable vendor, I do not have an opportunity to keep washing my hands frequently.
Right.
So for them, sanitizers are good, but then we need to keep in mind that whether you're washing our hands with soap or with sanitizer, we should keep a kind of a moisturizer handy with us, so that every time you wash your hands, at least you just dab in the moisturizer on your palms, so that is itself working as replenishing the moisture which we are trying to take away. Mm-hmm. For basic purposes, for household people who are not in the kitchen most of the times, or who are feeding kids and they feel that these creams might get into my body, even a normal ghee which is available in the kitchen is a very good alternative, which is natural and pure. Also, petroleum jelly or even your baby lotion are good moisturizers which can be handy, and that can prevent your side effects of the sanitizers on a more longer base.
So I guess those who actually have babies at home would be luckier, because they would have a baby lotion as well as baby soaps readily available.
Exactly. Even for normal use, we recommend a lot of these baby products because they are milder than the commercially available ones.
Right. Doctor, we'll talk about what exactly happens to the skin. You're a dermatologist, and what are the side effects that actually happen to the skin? We'll talk about this after we take a short break.
FM Rainbow 107.1 MHz, musically yours.
52 minutes past 8 a.m. We're on to Hello Mumbai, listening to All India Radio's FM Rainbow channel on 107.1. This is your 𝐅𝐨 Bosco Rodriguez with you on the show, and we're in conversation with Dr. Ram Tainwala, MBBS MD dermatologist, practicing at Malad for the past 10 years. Doctor, how does one recognize signs and symptoms if one has a skin problem?
So coming to skin problems because of excessive hand washing, first, you will have a little bit of the earliest signs would be your skin will start getting a little more dry and will get a little more flaky, especially around the finger edges and the palms. Also, there will be a little bit of itching and rashes because of the repetitive hand washes, especially between the fingers, around the web spaces as we call it, or also below your ornaments. So below your rings, below your bracelets, bangles, and all these, you will have the remnants of the detergent leaving behind there, which can cause you this itching and rashes. A little more advanced versions of these will end up showing you a little bit of redness and flaking, and also a little bit of crackling of the skin of the palms and toes. And on chronic hand washing, when people get a little obsessed with their hand washing, you can even end up with this little thick palms where you have the thick chronic, because of the chronic washing, you have a little bit of thick thickening of the skin. We need to understand sometimes if you are using something which is absolutely not strong, which is absolutely strong, so like acid-based detergent or something, you might even end up with a little bit of blisters or painful, itchy rashes on the palm. And these are the signs where you need to visit a dermatologist at the earliest. So for starters, when you have these kind of rashes, if you have the basic cracks and stuff, you can use the moisturizers as we discussed. Also, you can use some basic antibacterial creams, something which is like a fusidic acid-based cream, which is available locally in the chemist. And that is the first aid cream which you use any which ways at home. And that is something which you keep put on these things, and they might take care of these problems at the basic level. A special care needs to be given, especially for those who are a little more compromised in their immunity. So, elderly patients, people at home, people with diabetics, people on dialysis, they have a little basic decreased immunity. So, when you have an infection going into them, it replicates or multiplies multifold.
Okay.
So, it's better to take care of them more better.
And doctor, in conclusion, what would you want to tell all our listeners?
So, our government is doing a very good job, and we are kind of in the pioneers among the world who take care of the pandemic. And please follow the instructions well. But at the same time, we need to realize that people who are stepping out of the house, people who are handling potential stuff which is coming in contact with other people, are the ones who are potentially at risk of taking the virus home.
Right.
So they are the ones who should be washing their hands frequently, but again using the milder version and taking care of the moisturizing after that, so that it is taken care of well. The people, just by sitting at home, just by watching television, getting paranoid by the news, are washing their hands frequently. And they're using their moisturizers, they're using their sanitizers like water, which is where this problem starts.
Okay. Yeah, I think that's very important for listeners to know that not to use sanitizers like, you're using a gel or something like that, and washing your hands with a sanitizer.
Yes.
Yeah, you're right. Thank you so much, doctor, for sharing your views with us. I'm sure our listeners have taken those tips really seriously. And thank you, doctor, once again.